So both of you come to office in January of 2019 on this wave of euphoria for Democrats. The most diverse House we've ever seen, more women than we have ever seen. But you end your first term confronted with an enormous challenge, which is the COVID-19 epidemic, and one that has hit um, communities, and particularly Native American communities, harder than most of the country. Could you talk a little bit about that? Why that is, and were you surprised? And do you think Washington has really understood the devastation?
Well, so I'll start. First, I think that um, there is a lot of educating that needs to happen around the structural issues that Native communities face, the long, complex history of this country, and why we're in situations that we're in tribal communities. You know, some of the impacts that we're seeing, the disproportionate impacts of the coronavirus pandemic, have to do with consistent underfunding of the Indian Health Service, or investments in infrastructure in Indian country, investments and funding for urban Indian health centers. There are a number of things that have compounded over the years that have led to a point where a pandemic that's really putting a stress test on lots of places in our country has really highlighted and in some instances exacerbated the issues that we're seeing. And I think that when it comes to, does Washington understand what's going on in tribal communities, I think the baseline is no, but that what we've got is tons of tribal leaders out there, and advocates from Native communities showing up and trying to make sure that policymakers understand what's going on. And I think that one of the most amazing things about getting to serve in Congress alongside Deb and as colleagues with members of Congress and peers is that we have the opportunity to really educate as much as possible, to educate our colleagues and their teams about really why we're in the place that we're in and why it's so important to fulfill the responsibilities that the federal government has to tribal governments. And I think that, you know, I think that that's probably one of the most impactful things about having the first two Native women serving in Congress.
Congresswoman Haaland, I mean, what do you think that Washington should have learned from all of this?
You know what I'm thinking about right now is the fact that when we were working on one of our first, COVID packages, that the administration didn't want to give any money to Indian tribes. A lot of us got on the phone to say this needs to happen. Tribes need to have their funding package set aside for them so that because they know their communities better than anybody. And so we were able to get an $8 billion package in the CARES Act for Indian tribes. And everything Sharice said, yes, Indian country suffers disparities because of decades and decades and decades of underfunding, because the U.S. hasn't lived up to its trust responsibilities. So we definitely have a long way to go. And what I'll say is, it's, this term, the 116th Congress, we got sworn in during a government shutdown. And then, now we're dealing with this COVID-19 crisis. Both health and economic crisis that will take us a long time to remedy. So it has been a challenge. I really wish right now that the Senate would understand how dire things are for the American people. It's yes, it's Indian country, but yes, it's communities of color across the country, and folks who can't pay their rent and don't have health care, and it's a devastating situation, and hoping that they will come to their senses about it.